Yes, thank you. Good morning, Mr. Speaker.
Good morning, go right ahead.
Excuse me, and honorable members. As this honorable House will recall, a 14-day quarantine in a government-approved facility for unvaccinated travelers came into effect on the 20th of June with an end date of the 30th of September 2021. The purpose of the 14-day quarantine is to curtail the movement of unvaccinated, recently arrived travelers to the island. The incubation period of COVID-19 is between 2 and 14 days, and that sets the quarantine period. Mr. Speaker, after an outbreak of COVID-19 in March and April this year, Bermuda enjoyed a relatively calm early and mid of COVID-19 fueled by a coronavirus variant of concern, the Delta strain. It is highly transmissible, and its symptoms are very easily confused with a summer cold or allergies. As a result, we find ourselves in the midst of an outbreak where local transmission of the disease far outweighs the incidence of the disease among travelers. Mr. Speaker, this does not mean we can relax our border controls. However, the reality remains that the virus, which causes the disease COVID-19, arrives in Bermuda via travelers. And as we grapple with the current outbreak, we cannot lose sight of the need to keep our borders strong. Therefore, the 14-day quarantine requirement for unvaccinated travelers will remain in place, but they will be expected to quarantine at home after the 30th of September. Mr. Speaker, to ensure unvaccinated air arrivals are not in any of the quarantine hotels by the 30th of September 2021, the last of the unvaccinated travelers to check in will be tomorrow, Saturday, the 25th of September. Unvaccinated travelers arriving on Sunday, the 26th of September, will access a new process when applying for their travel authorization, and those travelers will be expected to quarantine at home. Mr. Speaker, please note there will be no changes to the travel authorization or protocols followed by vaccinated travelers, and the majority of our travelers now are vaccinated. Mr. Speaker, the travelers who undergo the 14-day quarantine will be fitted with an electronic monitoring device and a red wristband. They will be required to remain at their accommodation for the full period. The only tests they must have are the arrival test and their day 14 test. As part of the travel authorization application, the traveler must declare that he or she can quarantine at home alone. Any and all of the household members must quarantine as well. The only exception will be for those with a medical certificate, and this is unchanged from the current situation for medical travel. There should be some unvaccinated residents who travel but cannot quarantine alone or whose household members cannot quarantine with them. In those cases, the travelers must stay in a paid accommodation. There will be no specific quarantine hotels, but the travelers will be monitored in the accommodation of their choosing as if they were at home. Mr. Speaker, for the avoidance of doubt, all unvaccinated visitors to the island, and this does appear to be a small, curious tourism niche, they must quarantine for 14 days in a paid accommodation. Also, all those residents who arrive on island without a travel authorization and cannot quarantine at home alone must quarantine in a paid accommodation as well. It may be that for those unvaccinated travelers, their household members will later agree to quarantine with them, and in which case the traveler can check out of the accommodation and complete the 14-day quarantine at home. As is the case now, Mr. Speaker, household members who quarantine with a traveler will be fitted with a red wristband. The wristband must be worn until the entire household tests out on day 14 with a negative test result. Mr. Speaker, I am reminded that at the beginning of this marathon of a global pandemic, our main measure of success was that we would not overwhelm our health system. At this point, unfortunately, we are not succeeding. Residents, frontline workers, ministry staff, the third sector, local businesses, international business, all of us, we have to work hard and work together in this fight against COVID-19. The marathon is not yet over. Thank you, Mr. Speaker.